All right, here we go. Well, hi everyone. I'm super pleased to welcome you all for the 27th Global Community Call for the OpenCovid19 initiative. It's been, I would say, probably, I haven't actually looked at it, but I believe this could be the 1-year anniversary of OpenCovid19. We made our first global community call by the end of February, something like that. So I don't remember the exact date. I should have looked it up, but I believe this is the 1-year anniversary. So happy birthday, OpenCovid19. It's incredible to see what has been going on in the last 12 months. I think we really proved that communities are not only able to do magics, but they're able to do things that only institutions or companies would have been expected to do. So I think we really taught the world something here. And this is just the beginning. I believe that the post-COVID world is going to be much more open about community-based initiatives like this one and what you guys are doing. And so it's very positive for what's coming next. So without further ado, let's start with some general updates. Let me share my screen. Here we go. So just for the record, yeah. So those are general links for the OpenCovid19 initiatives. And then let's go to the next slide. There's a little bit of lag. Right. So for this global community call, we'll be talking about a little bit of general news coming from JOGL, like the platform. There's been a lot of movement in the hiding in the background. We've been working very hard, and the team also has been growing on the platform development side to really face the demand for new features and improvements. And so we'll be talking a little bit about that and what's coming in 2021. We are actually also hiring. I'll be talking more about that. And finally, like one of the core subject of today with the project update is the announcement of the macro round 5. So I guess before we go into the platform news, what's going on with JOGL is very interesting right now, and I was just talking about how community-based science innovations is becoming a thing, and the next decade is going to really be about that. Is we're seeing institutions now looking at such initiatives such as JOGL and say, okay, this is working, and we've been under shackles. We've been really frustrated about our own processes for such a long time that maybe we should actually take that path too. And so we've been talking about with different institutions in France and abroad, and we hope we are working throughout that we'll be able to bring them over and use platforms such as JOGL so that they can their researchers, their innovators can work using an open framework, but also collaborate with you guys, so that having more collaborations between grassroots innovators, entrepreneurs like yourself, but also researchers and other social entrepreneurs. That would be really amazing if we can scale that with also resources that are already given to those institutions. So so that's what's going on in the background. We also have established communities that are joining JOGL also, as JOGL is becoming this open framework to support community-based science innovation. So basically, our goal is really to develop the right tools and services so that you guys can really scale, can really go at it at your own mission, and don't have to, think too much about okay, how much this is going to cost, how much time it's going to take, where the right person. Like, it's so difficult to scale and to build a community when you're not an elite actor, in an established institution. Or if you're not doing a startup on a program that is very easy to fund. So that's where we are. We'll be sharing more news regarding those communities. One of them you already know is the IGM community. We've been doing things with them last year, and we'll be scaling that in this year too. And some of the ones I don't want to spoil too much, as we are preparing things in the background too. But the whole idea is that we'll be able to connect those various communities together so that they will be able to create even more amazing projects together. Next, some platform advancement news, and I'm going to call Luca, who is our lead developer for the front end. Luca, you want to speak a little bit about what's going on?
Hi everyone, sure. So yeah, I would say that like the first update on the platform is that it's a faster overall platform, like loading time and everything, and it's something that we always try to improve little by little. Then a new thing is as a project admin or project owner, you can now set 3 new information on your project. So the project status, so what its status, if it's draft, if it's active, and so on. You can see that in your project edit page right now. The level of maturity of your project also, that's a good info for the person that are looking for your project. And also you can specify if it's looking for collaborators or not. Next, also in the user page, you can now see the challenges and the programs that a user belongs to in his collection tab. Before it was only projects and group. Also now as an object admin, so as a project admin, you can invite multiple emails at the same time to an object. Right now it was only one, now you can invite many people to your object to join JOGL. The FAQ page is not new, but it's a reminder because it's a place to find really nice information about the platform and about JOGL in general. So you can find the link in the footer of app.jogl.io. Yeah. Hello.
I think it was.
And then you can also see the full changelog, because this is only just a few, but you can see the full changelog. Also, the link is accessible in the footer of the platform. Also, a reminder that you can also contribute on JOGL via our GitLab, which is like a GitHub. It's the same, but different platform. The link is also in the footer, and if you want to contribute and contact us, feel free to contact us at this email, which is my email. And also coming soon is some new onboarding that will come on the platform to really make this process easier and really clear. A refreshed homepage so that you can better access your objects, like your feed and like your different objects, and be recommended like users and so on. And so much more is coming. And also about the project, I was talking about like the maturity of the project. And soon we'll also have like a timeline, so you can specify like the big milestone of your project. And so we can easily see how a project is advancing throughout the time. So yeah, thank you. That was it for the platform updates.
Yes, thanks, Luca. I think we can mention also something. I believe we've been talking about it in the past, but one of the main features that's coming is what we call spaces, JOGL spaces, and so that is a feature that is specifically made so that existing communities can exist within JOGL and have their own boundaries and have control over what's going on there. And so that is coming up very soon, like in a month, something, also. And we are already working with established communities who are building their space as a beta version. If you are yourself interested in being a beta tester and bringing your community over to the JOGL platform, contact us, so that we can learn also about what are your needs, because at the end we take this into account about how we are developing the platform. Thank you so much, Luca.
Thank you.
Yeah, and so I guess we, as we're telling you before, we saw the dev team increased and almost doubled actually by welcoming Juliette, Nathan, Isabelle, and Lucie, who are all developers or specialized in UX and UI, to be able to face this demand of new features. And so we're really happy to have them in the team. So we've been sharing in the past couple of weeks some announcements about the fact that we are looking for various positions, so if you're interested, don't hesitate to contact us, or even just if you could share this that announcement within your own community, we really appreciate that. But yeah, next is a little bit of an update about JOGL Africa with Gamely.
Yeah, hello everybody. Those who haven't met, my name is Gamely Ajao. I come from Ghana. And basically the JOGL Africa program is looking at responding to issues that are unique to Africa and take advantage of unique trends as well. Our initial focus is on One Health, looking at animal, environmental, and human health in an integrated manner. And so we are basically using the best practices that JOGL programs like Co-Immune and OpenCovid19 have achieved to kind of inform the way we organize this program. And like Thomas mentioned, one of the roles that's open at JOGL currently is a program coordinator for JOGL Africa. It's been really interesting. We are getting a very vigorous response to this job application, and looking forward to partner with you and your various organizations as we develop this program. Thanks.
Yeah, JOGL Africa has been in the building for a long time, and it's coming along pretty well. And the whole point is to have local presence so that we can better address also African, the needs for African communities and around African problems. And so, because that's when you look at the map of where our JOGL users are, Africa is really one of the places where it's the most empty so far. And so the idea is really to understand how to connect with Africans so that we can connect also Africans with what's going on with our current communities too. All right, thank you so much, Camille. Well, okay. I guess this is like the big fish of today. And to introduce the microgrants round 5, I'll be calling for Chris. So microgrants has really been a very successful feature of JOGL that we tested out starting in 2020 last year. And it's a model that we'll be pursuing and will be developing. It's something that really prove how when you provide the responsibility to a community to choose what are the projects to be selected and funded, it actually works, and it creates this sense of responsibility has been really really interesting, and it's very agile in the sense that we it doesn't put the pressure and the responsibility over the institution, and that's good. And so if we want to scale this and offer this even as a tool later on for projects and communities that are building themselves around within the JOGL community, this could be also a way for them to attract donors, and so that they can create like pools of donations that can then be used by the community to choose on how to use that money for grants, like on which project should be chosen. We could even actually go back a step and say, asking the community what are the big subjects to be worked on, and so those are the kind of things that we're brainstorming around those last few weeks. Is how do we generalize the logic behind microgrants, and so we involve even more you guys, the community, in choosing what's important, and what are the projects that are the most relevant for working on those subjects. And so, this is exciting. This round of microgrants is very much like the other ones still. It's mostly funded by the AXA Research Fund. So we thank them for that. And I will call for Chris to introduce it.
Okay, I'm going to share my screen, I think, if possible, so I can show you the how it works. But maybe I'll just go through it first. The round opens right now. So theoretically, you could click that link and apply with your own project. I think I'm able to just share my screen now.
You want to share? Yeah, sure. Yeah, you can go.
So I'll just share how to apply for a microgrant. It's quite simple. So the microgrants currently are between 4,000 euros for projects that have already applied and been successful with funding, or 2,000 euros for those who have not applied before. So the first step is just Google JOGL. It'll be the third one down, but I'll just have it here, and then explore. And once you're in, first you have to make a user account. So it's kind of like a social network we've got going. Internet's pretty poor at the moment. But once you're in and you've made an account, we've got programs, and these programs are sort of designed around specific topics. So OpenCovid19 is about COVID-19, of course. We've got iGEM and CoImmune, and that's quite an old one. And you can also explore different projects and also members and groups and challenges, etc. So there's two ways of finding the challenge or the funding. So if we go to the OpenCovid19 initiative, which is what most of the projects are about, the new way of applying for microgrants is through challenges. And you can find challenges here, but we'll just click it here. And it's this thing. So OpenCovid19 grant review round 5. Just click that. And we just opened this, so no one's joined yet. And basically, as a user, you join a challenge by clicking a join challenge button, which is here. I'm not going to leave the challenge because I'm an admin on it. So if I left it, then I wouldn't be able to do anything. But then to actually submit a project for grant, you need to submit a project. Now, to submit a project, first you have to have projects to submit. So we actually have like a guide on how to make a good project. And effectively, this challenge, once you submit a project, becomes a repository from which we'll give reviewers access to. So we'll give reviewers the link to all the projects that are in this challenge. There aren't any currently because there aren't any projects. And then you'll fill a form from 1 to 5. So I'll just go through how it works. First thing you do is create a project. So it's quite easy to make a project. You put in a title, short description, things like that. And then once you've made it, then it's done. But one second, sorry. I've already got some projects made. So if I look on this project, for example, so this is the project on a guide in creating an open community. It's made by Alex Maines. Once you've made your project, you've got this little edit button here. So I'm just going to click that. And sorry, just waiting for things to load. You have a project banner, so all the projects are identified. Oops, sorry, my computer's going a bit crazy. You've got a project banner, which is obviously the identity of your project, and then you've got this about page and description. And it's in this description and also in your documents where you put things to apply with. So if we go to the challenge again, sorry, back up. So with that, if we go back to the challenge, you can see that you need to follow this template. So just below the instructions on how to submit your project for a grant application, there's a template, and in that template you have your project title. And just like before, we've got like different sections. This is like a formal grant application, but anyone in the world can apply, of course. and it has to be COVID-19 related. Introduction, project implementation. Then basically, I think a good way of doing it is copying and pasting this and following the instructions. And then once you've got a nice mature project, so I think a really good one, open enzyme production. It could be that the people who made this project are in the call today. Well done. They got funding before, and they have the project and background and solution. And basically, they just put the grant application here, and they've also got a budget as well. And within all that, that's how your project is reviewed. And in 2 weeks' time, so after the deadline, which is on the 14th of March, that's in 2 weeks, the challenge will close. And finally, we'll send an email to everyone who's applied. And within that email, we'll have a form. And this has worked really well in the past. It's a form with questions from 1 to 5. And we found that the scores are relatively stable. So these are just random graphics about that. We found that the scores around about 3.6. And we've also found that quite a lot of projects are successful. And what we have is we have a cutoff of projects of a certain quality, and those who are above that quality, they will be able to achieve the grant. And it's done democratically. So once you've applied with your project, you then are asked to review 3 other projects once the deadline comes. And then once you've reviewed those projects, that's how we get all the reviewers. That's how everything's so cheap and how it's so efficient. We'll tell you the results. So I think at the end of March. And that's it really, unless I missed anything. Yeah.
All right. Thank you, Chris.
It's all via the platform now.
Yeah. So the peculiarity about this round is that we put an emphasis on project that already have a track record. Where the COVID-19 pandemic has been going on for more than a year now, and so we have several projects that are really advanced, and so we want to be sure that they can benefit from the grants first. If they have good results, they need to go ahead. Though the round is still open for a new project that haven't applied before, but they need to have an established team, and a solid approach. Like we won't be funding just bold ideas like we did at the very, like a year ago, for example, when everything was started. All right.
Just so it's said also on the slides, I've made a little video on how to do that, whereas in more composed mood.
Yeah. Thanks, Chris. All right, so let's move on. If you have any questions, don't hesitate to contact Chris regarding that. Chris, you can share your email again in the chat if necessary. Next is project updates. So let's share my screen again. Okay. Where is it? Here it is. All right. So if you haven't yet, you can go on this document. The link is was shared in the Slack announcement channel. If not, you can maybe Chris, you can share it in the chat again. But there's a template that you can follow, and basically this is used also to record your updates at every global community call, and so it's kind of like an archive if you want. So it's nice. So the first project we're going to share information about is accessible genomics. So unfortunately they cannot be there. So Khalil cannot be there. It's a little late for him, in the Philippines, but he has shared a video with us for us. So I guess let's check it out if you want to work. Yes. I wonder if you will be able to hear the sound. You let me know.
Hello.
Can you hear it? Perfect.
Yes.
I'm recording this update on our JOGL project called Accessible Genomics. So, see, I also updated the presentation for Accessible Genomics. So, well, the update is that phase 1 is complete. Phase 1 is wherein we bring in the sequencer and all the reagents we need for sequencing SARS-CoV-2, and all the trainings are complete as well. We organize trainings for the local lab for nanopore sequencing, the library preparation protocol, and also the bioinformatics pipeline. And yeah, I've also shared the project management lessons from phase 1. You could also access the presentation there. Yeah, this is a link to the YouTube recording of that webinar. So next steps will be phase 2, which is the actual sequencing and genome assembly and analysis of SARS-CoV-2, and then sharing the results to like a global repository like you said. So, and then phase 3, we will create a deployment playbook based on experience. And then we have other projects as well, resolved and bringing genetic sequencing to the Philippine schools. So, yeah, so this is the slide deck I use for the update on the lessons learned from Accessible Genomics. So just these are the next steps for that project. And one of them is like creating the playbooks. If we want to use user-centered design or design thinking as a methodology for actually creating this playbook. The playbook doesn't have to be an actual book. It can be like community, it can be training, whatever. So we want to base it on actual user insights. So, we're going to talk to labs in Africa, South America, and other parts of Asia, see what the labs really need, and then we'll design solutions based on that. We also, project resolved is the next step. So Accessible Genomics is bringing in the training, the know-how, the sequencer, and the reagents to Southern Philippines. So from there, we could share what we learned, and also help them procure the equipment and the consumables needed to sequence SARS-CoV-2 and other pathogens. That could be the second degree. We'll also experiment with crowdfunding. We'll see if we could raise $6,000 and equip one other lab through crowdfunding. And then if this is successful, we could share the experience and how to do this with other labs so that they could also raise their own funding from the crowd. There are other projects which are ongoing. We're not involved in them, but they will greatly benefit us. These groups are trying to make it easy for labs to assemble genomes and analyze them. So right now you need a bioinformatician in your team to actually do this, but with better technology, perhaps you won't need that, and then it will make deployments easier. And also another last thing which I want to do after perhaps this project, after the pandemic, is to bring genetic sequencing to Philippine schools. I realized that the main bottleneck in establishing genomic pathogen surveillance across the country is not the equipment or the reagents. They are difficult, but it's straightforward. Just have to bring them to the country. What is lacking really are the wet lab experts and the bioinformaticians. Imagine if each biology and medical student has the chance to sequence an organism the way that right now each engineering student has a chance to program software. So if we could make this happen, then we'll have a lot of future scientists who could help bring genetic sequencing, genomic pathogen surveillance across the country. So that's our update. And if you have any questions, just ping me at Slack, and happy to answer questions.
Awesome. Great video. Thank you, Kyle, if you look back at this video. So don't hesitate to write to them if you're interested. The next project is Vol School with Oba Sigun. I don't know if Oba is here, but
hello.
Hey, Oba.
Hi. Okay. Hello, everyone. So I'll just quickly give a short background on Volt School and why we are doing Volt School. Sorry, I'm on the road. So when the pandemic hit the world, we quickly realized that the problems that faced Africa were kind of skewed in comparison to other first world challenges. One of the major problems for us were social problems, and we realized that more than 39 million students were out of school. So we said, is it possible to quickly deploy a virtual learning platform where students who are out of school due to the pandemic easily learn, have access to practical lab work, and also maybe be able to measure that over time. And so we launched in June last year, and with the support of the JOGL micro grant, and we fast grew beyond what we expected. Initially, it was focused on just West Africa, but we grew in 6 months to 9 countries across Africa. We currently have 11,000 plus students who learn actively every day on the platform. We have to even increase the server infrastructure because we crashed a couple of times last month. So yes, so that's the growth. In December, we were recognized by the African Union for top 50 education innovations in Africa, which was really quite exciting for us. We also last month partnered with 2 Nigerian universities to deploy virtual labs on both school. They already have the technology which they have developed in partnership with the MIT iLabs support. And so they could just deploy that same technology for us on both school. So from beginning of next month, mid of next month, most likely, would have the virtual lab fully functional for students to have access to do basic experiments like titration and some of all this science-related experiments. One of the really challenging things which we realized running Vol School was because we had all our teachers decentralized across Nigeria, Africa, Liberia, and a couple of other countries. We had to figure out the best process or methodology to make them create virtual content that could be pushed on the Vol School platform. Some of the next steps focus on user, the kind of users which we have, getting more students from across Africa, also increasing the number of contents which we have on the platform. Something also exciting which we're looking to work on is so we're building an AI model using K-means mapping to be able to see how we can monitor activities of learners on the platform, whereby we'll be able to give recommendations for topics. So for instance, a new learner comes on board, he's able to start learning, for instance, about plant cells, and then he goes to DNA, for example. over time, we'll learn from all these different activities or all the different learners. And then when a new learner comes on board, we can tell you, oh, 50% or 60% of learners who went through this learning path had higher grades, which they took the quizzes which they take on the platform. So we could give all these kind of useful recommendations to users. So we are also building an AI component into the Bold School platform. So yes, that's it. I can reach me on Slack, Obashegun Adele, email, and the Bold School platform is boldschool.com. Thank you.
Thank you so much, Oba. Great updates. Congrats. It's amazing. So don't hesitate to contact Oba if you're interested, in what he's been working on. We'll be moving on with to the next project, which is a basic respirator from Hunter Futo.
Hi. So it's been a couple of months since I've been on the JOGL call. So the project has been getting a lot of traction the past couple of months. I didn't think it would. So first, I participated in a startup funding event on Sunday. So for those of you that don't know, I've been working with the Veterans Health Administration on this project, and they've been doing a great job of promoting it across, across both the VHA and then in various levels of federal government, a lot of the military too. So there's a lot of interest in the project, and it's looking like I'm going to be going into a startup or founding a startup for it, which is exciting. Ooh. So and then the other thing too. So also I contacted, I'm not sure if I talked about this on the call before, but I contacted Advanced Functional Fabrics of America. They're a federal institute that was a nanotechnology lab out of MIT for textiles. They're working on things like computational textiles. So I told them about the project and gave them a little demo. So they agreed to sponsor testing for it, initial testing. It wouldn't be pre-certification, but it will at least tell me whether or not the materials that I'm using in the construction are gonna work. So they're testing for things like bacterial filtration efficiency and hydrostatic, like water testing. So I'm waiting for those results. The Fabric Discovery Center at University of Massachusetts Lowell is actually conducting the testing. So I also had to build a team. So I found an industrial designer that's an expert in soft goods. He's on board. I found another testing provider that's willing to help me out for free called, I think, Ator Labs is how you pronounce it. They're in Florida. They're going to be helping me with the respiratory testing. And he's been doing some design consultation too. And then I found a regulatory strategist to help me with certification and the FDA process. So my goal right now is I'm hoping I can, the highest classification that I can get is a surgical respirator, which would make it appropriate for use in healthcare. And it would be a reused surgical respirator, which I think this might be the first product in that category. Right now, the only surgical respirators I know of are disposable. So it's important for the environment, hopefully can reduce cost, and hopefully I can make this more accessible than other reusable respirators and make it available in healthcare. So looking for a customer that would be interested in that. Obviously working with the VHA, I'm going to talk to them about doing a pilot program. But I don't have funding yet, and it's going to take a while for me to get that. So I'm going to try to find, hopefully I can get the US government to pay for it. And I applied to the Air Force. They have like innovation program. So I applied to them for their program to get funding, but it would be at least 2 or 3 months before I heard back on that. So I'm just going to I have a little bit of left in my account, and I might self-fund it a little bit. And so I'll see if, and maybe a JOGL grant too. I'm not sure about if that's a possibility. So that's kind of what I'm working towards, because I'm going to need to probably hire a manufacturer to produce masks for me, because I can't sew that much. It's a lot of work. As far as next steps, so I did need to update the design and then send that over to the lab in Florida for respiratory testing. And then this is an open question, and I don't think we can cover it on this call, but I'm talking to, starting to talk to VCs and accelerators. I have a mentor, and I'm wondering, how can I become a startup but still keep this project open source? If the government is willing to invest, I don't think that's a problem. And there's a chance that, the US might, sort of adopt this as a design. But if I do have to go the private funding route, I'm not sure how to navigate that. I know people think I'm crazy for giving up an idea that, could potentially make a lot of money. And I don't care if that's, that doesn't matter. I want to make these available to anyone that needs them, especially during crisis situations like these, and not have to worry about, patents or licensing or paying the royalties or anything. But at the same time, I need a job and I need to, I haven't worked in a year. So, founding a startup would be great. And I think there's some other ideas that I want to do too. So maybe it might be another discussion, or you can contact me on Slack and I can set something up. But that's a question that I have to the community, is how do I go about that process?
Yeah, it's a deep question that is not, that there is no direct answer, and it's very case by case. I would say that ultimately, if your project is really impactful and the only way for you to get it, out there is to not to cut your path from being open, you should do it, because at the end what matters is that it should get out there. If, however, we can find ways to keep this open path, and it's what we're working on, right? It's trying to figure out paths to make this possible. But at the end, you shouldn't sacrifice your whole project just for an ideology. So there are many things, and there are some comments that are really really smart there also in the chat. And but the one thing for sure is open source doesn't mean free, and so it's really a matter of how do you want to capture the value of your project, and you don't need exclusivity, especially like when you look at masks. There are so many masks, and out there that it's not like people are going to mind if the project is under patent or not, whatever. Anyway, it's really a case by case situation, and we are actually facing like a similar situation with some of the diagnosis tests. As there will be some updates, but one of the projects is have done a partnership with a company in order to be manufactured potentially, and so it's how do you keep the balance, and how do you also make sure that at the end the project not only remains open to that, the R&D, like the foundation can be developed continuously, but also that there is a way for the project to be a mechanism of feeding back to the community, and so that other project derived from this one can exist and and get improved, etc., etc. Like for the diagnosis test, for example, would be development of diagnosis tests on other disease, etc., etc. But yeah, we're really at the early stage of I would say kind of like a small revolution here, because for the last 10 years it's been the startup revolution, and incubators and accelerators, and more than 10 years now. I feel like we're switching, and that now this is established, and we need to actually to define and strengthen those paths for communities to exist and be not constrained on one side being having the institutional path and the other side having the corporate path. So yeah, we'll definitely help you with that, but anyway, at the end, pragmatism first. So if you get like beautiful opportunities, you should go for them. Definitely. All right, thank you so much. You go ahead if you wanted to say something.
No, it's just really quickly. I'd like to make this a global project at some point too, because I think one advantage, and I've been looking at Khalil's project closely, the accessible genomics, because I'm thinking about if there is a possibility that there's a outbreak detected in a specific area, oftentimes those are also areas where there's garment manufacturing happening as well. So it would be nice to be able to create some kind of playbook like he is, be able to localize production to areas that need them rather than having to ship them from out of the country. So that's an eventual goal too. Thank you for the feedback. And I'm looking in the chat too, so I'll respond to everybody there. I'll say that.
Awesome. Well, thank you so much, Hunter, and beautiful news. Congrats. It's a beautiful work too. Next project is Project Lockdown with Jean. Hi, Jean. Jean?
Yeah, I'm here.
I know you want. Jean.
Yeah, before that, Hunter, I'm not sure if you've seen all the messages that have been going on the chat. You want to scroll a little bit up, there's going to be several addressed to you. So I don't know what happened to my voice, actually. I sound like a man all of a sudden. That's a Spanish joke, by the way. Okay, so my name is Jean-François. I typically go by John. The project that we've been working on since the beginning of the pandemic is not specifically very science-oriented, although it has to do with the COVID-19 situation. Essentially, what we do is we map policies issued by governments as a result of the pandemic, and we evaluate them versus their potential impact on human rights and digital rights. We started with that, and so we took a number of data points, put them together, and built a map that allowed you to see what was the situation in the past, but also what was supposed to be the situation in the future. And by that, what I mean to say is that we concentrate on very specific data. First, we only take sources from governments because we want our data to have legal merit. We want the people who are going to be consuming the data to be able to do and build argumentations and stories and possible policy changes based on information that is can be defended legally. And second, the data we get is only referred to their impact on human rights and digital rights. So when you look into the future, the time slider that we built, essentially what it tells you is if nothing changes, if a specific set of governments do not change any of their policies, considering the status today, this is how the world is going to look like in the next months. And so, of course, it allowed you to have a much more clear picture of how many territories were still going to be under lockdown and which other restrictions could have been applied over time. So that was version 1.0. And when we did our analysis about what was out there, we realized that we have the potential to turn the platform into a much more global rights observatory. That there isn't anything similar to this in civil society at the scale that we're doing with specific policies or orientation that we apply. We used to be at some point 80 plus volunteers across 15 time zones. Now we are down to 37. Things, of course, have changed over time. And so what we're doing now, we're building 2.0 to be able to allocate and render on the map more than just that dataset layer that we have for COVID-19. We had some supports from certain organizations as well from a financial perspective. And we also were in the list of winners from the EU versus virus hackathon that happened last year, which also opened some opportunities. So we are, I would say, 75% from developing version 2.0. We are also changing the web, and we're going to be incorporating blogging and telling stories about all the information that we are capturing. And we also started hosting the project through another sort of events that we do in my organization. I manage a nonprofit called the IO Foundation. And we basically host open source projects. By the way, if any of you would feel like are participating, we host open source projects that are trying to get community participation and that would like to be able to once a month run sprints to focus on a specific deliverable, and you would like to get one or two things done during that particular weekend. We will run it for 48 hours during the whole weekend, so we can span through different time zones. And so we've experimented with that first with Project Lockdown. It has worked pretty decently. And so because we found that the problem that we had with the rotation with volunteers was a very difficult one to handle. And so we are trying this model of allowing people to come to join for just a weekend, get things done, push for features to be implemented, and then the sense of pressure or the sense of having to commit for too many hours across the weeks is reduced towards the volunteer. The next steps that we are working on is, of course, finishing 2.0, which I'm expecting in the next couple of weeks. Start working on a campaign on the outreach for 2.0 so that we get a bit more traction and more usage on the platform. Develop the global rights index that we've been thinking of for quite some time. And then we need to change the back office. Until now, we are basically using a Google Sheet to introduce the data, which works pretty well for what we need. But now, once we start moving into different data set layers, and the next one that is coming has to do with encryption technology policies and contact tracing apps. That's not going to be scalable anymore, so we need to build one back office for ourselves. And we're also working on developing extra data funnels. By that we mean, how the data gets to reach into our platform. The one that we use right now is insourcing. So we have a team of people who identify the policies, they go through the document, they extract the data points, codify them, and put them into a database. But of course, that's also not very scalable. So we are looking into developing machine learning to be able to scan the documents. And so one of the things that we realized was that it was kind of stupid to just concentrate on the data points that we need for Project Lockdown. So we are trying to think about who we can partner with to have a general extraction. So policies that have not only to do with what we would use, but to also offer them for the civil society organizations. Since they are public documents, might as well extract as much as possible. But of course, that comes with a lot of training and a lot of, it's not going to be overnight. The one that we are much more excited about is direct feed, which is essentially providing public authorities the ability to upload their policy information directly into our database. It's basically an API endpoint and a data schema. And we are already in contact with a couple of public authorities, and the third one who might be interested in jumping in. Now, the problem is that there isn't a standard right now as to how to codify policies. There's a lot of standards for a lot of stuff, but how to codify a policy itself, it's still not there. So we also see it as an opportunity to try to design something that could be an open standard based on that. We've been in touch with Open Data Institute and some other players around. We've discovered an organization that has been finally looking into how to codify law. So how to generate, how to be able to make an algorithm out of law, to be able to analyze it from a machine readable perspective, which is a very interesting thing too. I think that's it. If there's any question.
Thank you so much, Jean. I think we have to move on, unfortunately, because we are running out of time. But congrats for all the work. It's really amazing. Don't hesitate to contact Jean. And if you can put your email back to the chat, that would be awesome. So next is we're going to hear about Ben, because I think he has to go.
I apologize. I wanted to jump on the call because everybody is working on such fascinating things, and the JOGL efforts are so complementary with what Helpful does, and in the sense of the ability to identify and determine what is likely to be a high impact or an important project that, against what it costs to pilot. And then what Helpful does is provide a framework, what Rob Reed would call, the lowest common baseline, or what I call the lowest common denominator across jurisdictions, by which I mean that, nations or states in legal frameworks regarding regulated domains, so medical, clean energy, food supply, because these are all fundamentally the same. And what my work within Helpful is, by courtesy, I'm the CEO of the not-for-profit, and is to identify what are the different stages, not just that are required to properly produce a solution in a regulated domain, but then if we're going to rapidly, meaning within 24 hours, look to try to scale this on a global level. What are the mechanisms that have to take place or be in place, and the structures that need to support this, that transfer of information in a trusted manner, resulting in the ability for a local entity, a community, or an entrepreneur, whatever, to productize it or commercialize it in the way that Thomas described, which is that improvements or changes to the artifact can then feed back to the common source or the head of the project, so that we can all kind of stand on the shoulders of the giants that came before us, in the terminology that Isaac Newton would have used, and who I like to refer to a great deal, because I think his concepts at which originated the Age of Enlightenment and led us, we've gone astray from it a great number of things, but we'll go down that train another time. In any event, what we've determined is this lowest common denominator and it's critical for whether it's a mask or a respirator, or a solution in any of these other domains, is the distinction between the design and the execution. It's the execution that gets authorized or certified. And there's so much that goes into that. About 80% of activity that is in the design process, that's actually not really the valuable part. The valuable part is the execution. And that is actually not a transferable thing in the way regulatory works. So in other words, sharing a design or knowledge around how to, what something is, that isn't the same thing as being able to just go and do it. And that's actually the valuable part of activity. Now, making it understand, social impact, social benefit funders and NGOs generally understand this, particularly the ones that support medical, or they increasingly understand it. So for example, some of our projects have received funding with this knowledge and around this concept. But the way that you maintain that design, there's versions of it. There's the variant that you just throw in the GitHub, and then there's the variant that sits in your design control. That isn't something that you can just leave open. Those design controls, the CAD file can stay open, the bill of materials can stay open, but the design controls, the risk analysis, the risk mapping, that can't just be, you can give visibility on that to an extent, but that doesn't include your manufacturing plan and your regulatory strategy, which is the valuable part. But the risk and the design control part of it still has to be maintained in a secure environment. And, because you can't run the risk that those things are subject to, uncontrolled, let's put it this way, alteration. So you don't want somebody to go in there and just mess with it. And it also, this is really critical because those things require, and these are concepts that exist across open source. We tend to think of them in terms of contribution, but it's really just the same word for, or an extended variant of it is traceability. In other words, when we're looking at a design that then gets productized, somebody has to be accountable for the decisions that are made in it, all right? Because if it goes wrong, that's what FDA or the European community or any other regulatory body, that's what they're going to investigate, and the activity around it, the documentation according, against it, along with, they want to know whose head they're going to put on a pike, is what this really comes down to. Now, this all then is against the lens of where does liability lie? Liability does not lie with the designer all the way. It lies with the people executing it. In other words, who productizes it or commercializes it, all right? So in open source, and especially as we move into regulated domains, and this includes science, pharma, I don't care what, all right? And it's the way that I look at what Helpful does is identify these things and what stuff is, but then provide a framework that allows for open contribution that includes traceability through the design phase. That's conducted in our not-for-profit structure. But then, look, somebody can pick that up and go productize it anywhere in the world. That's great if they want support around that. We provide service and support and tools that allow feedback and for that work to find its way into the controlled environment as opposed to just the CAD design locker, the GitHub or whatever, but in a controlled way, because that has to be sustainable is what the word is around this, that you then can execute and scale that thing all over the world. And as other people pick it up and use it, there's a path not only for that contribution to be recognized and included and traceable, but then you can receive value back on it based upon your maintenance of it in a public benefit corporate environment, which is what we're currently building out. So we've got the software identified that we're working on building that platform out, and we're in the early stages of doing that. And then there's additional questions around what supply chain looks like, and how that's done, metrics of performance. So these are things that we've been working on. Rob Reed, who's on this call, and I just submitted a proposal through NIST that's also going to go to HHS around an oxygen concentrator. So the idea is how cheap can we make an oxygen concentrator, get it certified, that the execution, maybe just 10 units that result in baseline performance of what that solution is, that execution artifact is, and then transfer that design and along with everything else to an entity in Africa and an entity in Mexico, where they can productize the thing themselves very quickly with our support. And the device produces some telemetry that you can then map back against the performance of the certified artifact and have visibility on whether or not the thing works. And because if it walks like a duck and quacks like a duck and you eat it like a duck, it's a pretty good chance it's a duck. So that's the way that we're looking at this kind of a problem, and this kind of a thing, and that is done through a strongly reciprocal license that has some additional requirements in it around proof of efficacy, but also traceability, part of which is accountability. All right, you can't do this with like a hidden name. You gotta put your money where your mouth is on this kind of work, in the sense of, like you have to be accountable for it. You have to be responsible. So that's the environment that we're creating. And to support these kinds of efforts, Helpful has tools that we're in the process of integrating. These include a quality management system that's FDA compliant, that's Zen QMS, who we very gratefully acknowledge their support in donating the tool into the Helpful environment, and Valaspace, which is an engineering requirements platform that we also gratefully acknowledge the donation of their tool. And as these tools get integrated, we'll be producing plugins for CAD software that allows the very quick documentation around design and risk mitigation. All right, which is so that part of the execution of the thing. And then, you have to be a little careful when you do this stuff in NFP environments and then commercial environments, such that you can maintain the solution in the NFP ultimately, because you want it there so that it's freely available to everybody in many respects. And also so that there's a common locker, making sure that it's up to snuff, and that there's oversight of the thing, so that it's preserved, the value is preserved, and it serves the charitable mission that I think most people kind of have, around these shared human values, around the solutions that we're trying to produce. So in this respect, that's the purpose of the Helpful NFP, is to facilitate this kind of innovation and then get it out there really fast but along, in a safe and responsible way. And with a path towards people productizing, competing on execution, but benefiting from the share and free exchange of knowledge, because that drops total cost of R&D. And if this stuff is done right, it reduces against what our mission is, which is the total reduction of systemic frictions and risks. All right, whether that's a local, national, international, global, and
So-
we come at it from those directions.
So this is awesome then, first of all, because it really touches like core problems that this community is facing, and we should definitely pursue this discussion further. Not during this call, because
it's just
from other projects.
but my point is that anything you guys do, like, I love what you guys do.
It's
Like, you
reciprocal.
guys solve a different aspect of the thing, and it's like it's why I love it, and I love the exploration and then the creativity around it.
And I have to share with you also that with people of this group, especially the people working on the diagnosis test, we've been working on the, let's say, framework to somehow, it's getting close to what you just said, but specializing around biotech devices, especially like diagnosis tests, for example. And well, I'm not going to talk about it right now because we don't have the time, but let's definitely set up a meeting, with Martin, with Rachel that are here, with Tatiana also, because this is one of the core subjects, for making those community-based, community-driven projects successful on the long term. And
I would be more than happy to. I mean, one of the things when you start talking about biotech or bioscience, these are areas that are, while most of what's going on within Helpful right now is hardware, software driven, the basic tools and requirements that I described around regulatory apply across pharma, across testing equipment, across sequencing equipment, all of this stuff. All right. And it's not that we're short on things like regulatory advisory. Like, for example, my mother, she's not recognized on the website right now, but is part of our senior advisory. My mom ran regulatory at Schering-Plough and Hoffman LaRoche and then 15, 16 other companies. I forget how many she started, but so we have some input and some knowledge around this, and she knows everything from the science to making the thing, to distributing the thing, because that's all included. Mm-hmm. Regulatory leads of pharmaceutical execution or of any type. It's not the CEO of the company. He just goes out and talks and raises money.
I'm looking forward to that. So yeah, this is exciting. Thank you so much, Ben, for this update and this.
It's my pleasure, and I thank you for having us. I love what you guys do. It's just amazing, and I love the projects that you support. People here are so creative. So I'm grateful to being allowed to attend the call. Thank you for Chris for including me. And I have to go run to another thing, but I look forward to speaking to any and all of you later, and hope that
you can, if you want, you can still watch the recording of the video, because we are going to have the update from the diagnostic team right now.
I will make a point of it. I will absolutely make a point of it. Thank you all.
Right. Thank
Bye,
you,
everyone.
That was a great, I don't know how to say this in English, but something that was not planned in the program, but that was great.
Segue.
A segue, thank you. So next is, we're going to continue with the project updates. And I guess next is Corona Detective with Rachel. Let me share my screen again. This is becoming complicated because I have so many spaces. All right.
So hello. I actually just heard from one of the Hackquarium members that the event that I thought was starting at 7:30 actually started at 7 o'clock. So I should go very quickly. But luckily, I've been able to present some of our things before here. And so I'll just quickly go through and say what's there here on the list that we've been, we made a paper, a short paper was submitted to a sort of academic journal, and all about corona detective, the method, and so on. I could share my screen and quickly show some things, but most of it you've already seen. But there's one part about the variants of the virus that are coming up and double checking that our things would still work. Should I try and share my screen?
Sure.
Yeah, I can't anyway. It says it won't.
Oh, no, you can if you want.
Okay, now maybe I can. There. So, yeah, the, oh, it doesn't have the, okay, I'll just go right to this one. So this is, well, but this is the, okay, I'll try this. But then, yeah, okay, so if I go here, will it, now you, what are you looking at? Now you see the wrong thing.
We're saying your Finder.
Yeah, it's not very good. So, so if I go, usually it lets you pick the window, I thought. Okay, so here's, so this is basically, shows some of the figures from the paper. So basically we showed that this corona detective is very sensitive. So A shows how sensitive with just 20 copies in a reaction. We get a nice bright signal that isn't seen with non-template controls or just a random environmental swab. And then we showed, as you guys have seen before, that the multiplex works well. So you can detect the viral target, which is NM thing in green, or the cellular RNA target, or both of them together. So the third row here shows what happens with the multiplex. And then it's just very sensitive and specific. We didn't get any false positives in our semifinals for the X Prize. And this paper actually shows one other thing that I think is really important about the double checking that this method will still work, even though people keep spreading the virus around and it keeps mutating. So here you can see one of our key results that indeed of the little pieces of DNA that we use, they're called primers. There are some mutations relative to a few of the variants that are being spread around now. So there's one Asian variant that has a mutation that we hope won't hurt too much in our analyses, in our detection of this virus. And there's another one in South America. And so we're keeping a close eye on all these different things. And let's see, I don't want to take too much time, so I'm just going to stop the share. And well, actually I could, there's the other fine good result that we have is that we've done some more clinical validation. And also I validated a sample that was from a sewage study, actually looking at the virus coming up in from populations as they use the waste facilities. And in fact, we did get a very good result. Let me see if I can share this too. It should be here. So a lot of you have seen this sort of data from me before, but so this shows actually the first two things. So it's a real-time sort of fluorescence signal coming up. And so the first set here is the this viral RNA is in the sewage sample RNA. So this is the undiluted. And then over here, these two are 1 in 100 dilutions. So even though it's diluted 100-fold, it's still detected very well. But the unsatisfying thing about this experiment, which I did just last week, was that my 1 in 10 dilution actually had this huge spread. So it's really nice when these two are clustered and those two are clustered. But I mean, this is real research. My 1 in 10 dilution, I got a variance that I really didn't like to see, but this is science. And then the really great news is that we're about to finally get a whole bunch of tubes off to Ghana and to Cameroon and to Chile to go ahead and get more clinical validation. And we're also in talks with a big company in America about doing a massive production run to make lots and lots of tubes that we can send to lots of people for more validations, and hopefully see that it's a very useful test for surveillance screening. Yes,
Awesome.
is there, I
Thank
see
you so
now
much.
Breed has his, oh, just a thumb up.
This is great. Yeah, we all hope that we're going to be able to get this test out there, and so that people can use them, and that it becomes also a foundation for the application on other kind of diseases. This is really fantastic.
It's really neat to have heard the word productizing twice when Ben was just talking, because I was complaining to Martin, that's not really a word, but yeah, I guess we want to productize Corona.
Here you go, Martin. All right. So the next project, we're going to continue on the diagnosis test. Let me share my screen again. So here we go. It's the 1 hour COVID test. So Ellen cannot be here, neither Ellen or Chris. Sarah, sorry, and Chris. But they have already developed a partnership with a company in the US called IV Diagnostics. And they're going to perform the clinical validation for them, which is a complicated step. You need not only potentially resources, but also knowledge and experience about that. So it's going to be interesting to follow, and we're going to learn in the process also first. Like, meaning that by watching what they're doing, we'll be able also to apply this to the other projects. So that's going to be cool. So we're going to follow what's going on, and we'll be updating you obviously if there is any results in any applications. Bye bye, Rachel. And next is the rapid action patient dispatch with Akub. I believe he is not here.
We have Ishan has to leave soon, possibly.
Yeah. So
and then Rob.
Let's go for Ishan's project, Opex.
Hi. Yeah. Should I share my screen? Is that okay?
You can. Yeah.
Okay. Great. Okay. Cool. So thank you for allowing me to present that. We're really excited about this microgrants round. So our project is called Opex. Opex is a startup / nonprofit focused on providing solutions for contact tracing. Our mission is to help organizations make data-driven decisions to reduce COVID-19 transmission. So far, the way our product works is it has two services. The first is an occupancy detection solution. We developed a sophisticated algorithm that coordinates with receivers around a room to use Bluetooth signals to be able to ascertain how many people are in a room at a certain time. I'll talk about the implementation of that, but the second thing is our more robust algorithm, and this was a deep neural network we developed in coordination with Raspberry Pi Bluetooth receivers. And the purpose of that is to work with Bluetooth beacon wearables to be able to determine a user's location relative to other users within the same room. And the purpose of that is being able to determine if there's a breach of social distancing and being able to contact trace. So we record the interaction, and if the person reports having COVID, then we report that. I know that a lot of solutions like that kind of exist, so I'll explain what differentiates us. So a lot of the solutions that exist right now either use a proximity-based solution in which they have beacons around your hand, they draw a 6-foot radius, and then they tell you how far away people are and record that interaction, or they're on your phone, that application. And the problems with both of those is that they're extremely inaccurate and they don't tell you where the interaction occurred. And so kind of what we do is we're able to determine exactly where in a building an interaction occurs. So people that are in that same building are able to determine which areas are areas of high occupancy, and are also able to determine where there needs to be deep cleaning, because COVID can stay on surfaces for 2 to 3 days. So it's important that people know, like, if there was a person with COVID and they were largely in this area within an office space, then this is an area they should focus deep cleaning measures on. So just some progress on like where we are as a project. So we currently have 2 working POCs. Our accuracy level, our distance algorithm is about a foot accuracy. And that's only over 15-second interval. The CDC guidelines stipulate around like a 10-minute interaction. And over that amount of time, we're able to accurately determine a user's location within a room. And so the progress, we've submitted our idea to 2 hackathons so far. So we won one of them and we were runner-up in another one. And right now, our mentor on the project, he developed a similar software for the occupancy detection solution, and he's currently working with Johns Hopkins University. We have reached out to a couple companies have reached out to us, but mainly the issue has been that we aren't old enough, or there's been like a spending freeze. Like our school district specifically, there is a spending freeze and we can't afford to implement the technology in our school district for a trial because we don't have the funding. So that's kind of why we're hoping to come to JOGL. That's what we need the funding for. But yeah, that's kind of about the project and everything.
All right.
And I can show really quick just some of the stuff. So this is a very basic thing that we created just to visualize what's being processed. Shoot, can I move this taskbar? Yeah, okay. So this is just a visualizer of what's like happening. So all these readings on the right, and we're processing like thousands and thousands of them. If we didn't take a weighted average, we'd be processing millions of them. And then this is kind of the display that we're working with right now. It displays things like the occupancy level of a room, the overall level of risk, safety risk, things like that. And then our contact tracing solution would be able to show like users, their contact risk, and a survey we created. Yeah.
Great. And so what would you be testing this solution at first?
Where would we be testing it?
Yeah, do you have like a region where you want to test it on a specific community or?
Yeah. Oh, sorry. I should have mentioned. I've spoken with Kat. She's an alumni from my high school. I think she's director of operations at JOGL. So we're targeting universities. Specifically, my mentor is working in capacity with Johns Hopkins Medical Institution because an issue they've had is in their labs specifically. People haven't been following the occupancy guidelines, and they don't want to have to put someone there to be constantly there, just making sure people are following those rules. So they want there to be some sort of infrastructure in place so they can get notified if there is a breach. So that's what the occupancy detection solution is being used for. The issues that we've encountered is that we aren't, I guess, as like my mentor on the project is like, he's a successful technology entrepreneur. Like he sold his tech company to Microsoft, some crazy stuff. And so he's like very accredited, but for us, it's a little more difficult to get it implemented, and people don't want to, spend their own money on something that isn't like that. So we're trying to get funding to be able to fund the trials ourselves to create a POC in the real world rather than just in our own homes.
Mm-hmm. Well, that was great. You should definitely apply and see how the community reacts. Mm.
Thank you.
Do you have, if people have questions for Ishan or remarks? It's getting pretty late, so I can understand. Normally we do actually 1 hour global community call, but since we haven't been active, we didn't have a global community call for a couple of months, and there was a lot of things to be packed. But yeah, thank you, Ishan.
Thank you.
I think we go to the next project. I think Rob, you're on with Public Invention.
Hi, thanks. So I don't really have a project per se. Let me be very, very quick here. Public Invention is a little like what you're doing and a little like helpful engineering, but Public Convention does not focus on FDA approval and does not focus on going to market. It's more what I would call research and real invention stuff, or at least we try to be. We compromise a fair bit here. The thing that might be of interest to some of your people is that we have a number of projects related to respiration support, which is mostly electronics, but we have an oxygen concentrator and a thing called the VentMod, which we have actually shipped, which is essentially a sophisticated spirometer, but you can be used to test a ventilator. Awesome. We also are building a ventilator with a project that's not that far along called Polyvent. And so right now, the vision for Public Convention is to build a complete open source ecosystem of respiration support, which at one time for COVID-19 meant invasive ventilation, but now means therapeutic oxygen and a lot of other things. So I love what JOGL is doing. It's a little, most of my work is kind of on electronics, and it's not all health related. I also do, that's health related. I do clean water work and energy and climate engineering stuff. So I have about 15 engineers, and I'm a smaller organization than either JOGL or Helpful Engineering. I'm actually on the board of Helpful Engineering.
This is awesome.
So if anyone has any questions about that, you can contact me later. I'm pretty easy to find on the web. And thank you guys for inviting me.
Yeah, I mean, thank you, Rob, for being here. I would love to learn more about Public Convention, you know, like the type of project you're doing, and I'm sure there are projects that you know, that your community is working on that, you know, could be plugged also to what the JOGL community is doing, and the Helpful Engineering community is doing, and you know, have like kind of like a global collaboration. So yeah, probably we won't have this discussion right now. Again, it's getting pretty late, but thank you for this sneak peek into what you're doing. And let's you know, write to each other and set up a meeting time, because
okay. It's my job to do that. So anyone who wants to have a meeting with me, I'm happy to do that. Thank you.
Awesome. All right. Did I forget anyone? Let me check. I believe we have everyone. So I think this is a moment where, well, I would like to thank everyone, even though most of the people had to leave the call, but this is a recording. So for the record, you guys have been really amazing, and we're just showing the past that you know, research, science, innovation can be done in another way, and I cannot be more proud of what I've just heard also today. It's really amazing, and so we're going to continue this battle, and we're going to welcome even more awesome people like yourselves and projects, and we see where this is going to go. But I'm excited, and so I'm just I wonder when will be the next global community call. I believe we're going to have it in 2 weeks. We're going to go back to a bi-weekly base. I think it seems to be working fine this way. A weekly base is probably not necessary when we look at the intensity of news that we currently have. So bi-weekly seems to be the right way, and we can always adapt if necessary. So thank you again. This is the end of this global community call, and celebrating the 1-year anniversary of OpenCovid19. So this is exciting. We'll see what 2021 is going to bring us. Be safe wherever you are, and have a great day, evening, morning, what applies to you. And talk to you all soon. Bye-bye.
Thanks for coming, guys. Thank you.